Why does pharmacodynamics matter for Parkinson's polypharmacy? Imagine managing a complex orchestra where each instrument must play in harmony. That's similar to how medications work together in Parkinson's disease treatment. Pharmacodynamics is the science that explains how drugs affect the body, including how they produce their effects and interact with each other. It's especially important when a person with Parkinson's takes multiple medications at once, a situation called polypharmacy. Parkinson's disease involves a variety of symptoms, both motor and non-motor. To manage these, doctors often prescribe several drugs that target different parts of the brain and body. For example, dopaminergic therapies like L-Dopa help with movement issues, while other medications might address depression or sleep problems. When multiple drugs are used, their effects on the body can overlap or interfere, which makes understanding pharmacodynamics crucial. One key reason pharmacodynamics matters is because of drug interactions and side effects. When drugs act on similar neurotransmitter systems, they can have additive effects, which might increase the risk of side effects like involuntary movements or hallucinations. For instance, combining different dopamine-related medications can sometimes lead to dyskinesia or uncontrollable movements. Also, medications for non-motor symptoms can interact with Parkinson's drugs, potentially worsening cognitive issues or causing blood pressure drops when standing up. Another important aspect is individual variability. People with Parkinson's are not all the same. Age, disease severity, other health conditions, and overall frailty can change how their bodies respond to medications. Older adults often have heightened sensitivity to drugs, which can lead to more side effects. This means that dosing needs to be carefully tailored to each person, balancing symptom relief with safety. Managing Parkinson's symptoms can be tricky because they often fluctuate during the day. Pharmacodynamics helps guide how and when medications are taken to maximize benefit and reduce side effects. For example, adjusting the timing of doses can help control tremors or stiffness without increasing the total number of drugs, which can lower the risk of interactions. Polypharmacy also raises concerns about cognitive decline and frailty. When multiple drugs are used, the risk of adverse effects that impair thinking or increase vulnerability grows. Recognizing these risks helps prevent a cycle where one side effect leads to more medications, complicating treatment further. Finally, understanding pharmacodynamics helps clinicians avoid prescribing medications that could worsen Parkinson's symptoms or interact negatively. Some drugs, for example, might impair motor function or cause unwanted side effects if not chosen carefully. Knowledge of how drugs work allows healthcare providers to select the best options for each individual, reducing unnecessary risks. In practice, this means doctors aim to use medications that can serve multiple purposes, carefully adjust doses, and monitor for side effects or cognitive changes. They also consider each person's unique health profile, daily routines, and other conditions. This personalized approach helps ensure that treatment is both safe and effective. In summary, pharmacodynamics is the foundation for safe medication management in Parkinson's disease. It helps balance symptom control with minimizing side effects and interactions, especially when multiple drugs are involved. Always remember, personalized medical advice from healthcare professionals is essential to navigate these complexities and improve quality of life.